You know that feeling when you're handed a prescription bottle or you happen to glance at your chart during a doctor's visit and it just looks like it's written in, I don't know, some alien dialect.
Oh, absolutely.
You see these massive, like 15-letter words, and your brain just kind of shuts down.
Yeah, it's the ultimate form of information overload, you know?
Right.
We are socially conditioned to look at medical terminology and just accept it as this impenetrable fortress of Latin and Greek.
Right.
It feels like a language designed to keep the patient out, like something only a person with a decade of medical schooling is even allowed to decode.
But today, we are going to dismantle that fortress.
Mm.
We're doing a deep dive into a really fascinating stack of sources we've gathered for you, ranging from clinical linguistics textbooks and historical letters from the 1800s to case studies on modern medical errors.
And it's all so interconnected.
Exactly. And the overarching theme across all these documents is that medical jargon isn't made of unbreakable monolithic blocks. It's made of Legos.
I love that analogy.
Right. Little combinatorial pieces. And today, we're going to focus on 3 of the most crucial prefixes in that entire set: a, an, and anti.
Yeah, and you know, while we're only talking about a handful of letters here, grasping how these specific pieces function gives you like a skeleton key.
A skeleton key for the whole dictionary.
Exactly. Once you understand the underlying logic, you can look at hundreds of clinical terms you've never seen before and just instantly know what they mean.
Which is incredibly empowering.
It really is. The core of this deep dive is about understanding a pretty profound philosophical and clinical shift. The difference between a body being without something versus a body being against something.
I want to start with the without part,
Mm-hmm.
because when I was looking through our linguistic sources, I assumed there was some deep, complex medical reason why one disease gets an A tacked onto the front of it and another gets an an.
Oh, sorry, that's what everyone assumes.
But that's not the case at all, is it?
Not even a little bit. The rule governing a versus an has zero to do with medical science. It's entirely about the physical mechanics of the human mouth.
Wait, really? Just the mouth?
Yeah. So linguists classify a and an as privative prefixes, meaning their entire job is to deprive a word of its quality. They mean without or absence of or, lack of.
Okay, got it.
But the choice between the two is purely phonetic. You use a before a consonant sound, like an asymptomatic or atrophy, and you use an before a vowel sound, like anemia or anesthesia.
Wait, so it's literally just the basic grammar rule for a versus an in everyday English, like how we say an apple instead of a apple.
That is the exact mechanism at play, because if you try to say a apple, your vocal cords have to do this clunky stop and start motion.
Oh, right, the glottal stop.
Exactly, the glottal stop. It's physically inefficient. So thousands of years ago, speakers naturally inserted an N sound to bridge the gap. You say a banana because the B provides the bridge.
That makes so much sense.
Right. If you mess up this boundary in medicine, you get unpronounceable tongue twisters.
Oh.
Think about a biological process that happens without oxygen or air. The root is aerobic.
Right.
You add the privative prefix and it becomes anaerobic. If you just slapped an A on it, you'd have aerobic, which it forces that awkward glottal stop.
Aerobic, yeah, that's terrible to say. So, okay, let's unpack this with an analogy for you guys listening. And an are essentially hitting the delete key on a bodily function or state. They erase it.
Mm-hmm.
Whereas anti is fundamentally different. Anti is like sending in a rival army.
I really like that framing. Absence versus opposition. Mixing those two up is actually the single most common error for students taking their first medical terminology exams.
How bad?
Yeah, because if a clinician is describing a patient who has stopped breathing, they use the erasing prefix. They're noting an absence. But if that same clinician prescribes a medication to fight your fever, they aren't giving you a drug that somehow just erases the abstract concept of temperature.
Right, they're giving you a chemical agent that actively goes to war with the fever.
Exactly. That's opposition.
So if this Lego system of prefixes is the foundation of the jargon your doctor uses, where did it come from? Like, did a bunch of physicians sit down in a room and invent this code from scratch?
You would think so, but no.
I totally assumed it was some Victorian invention, but the historical texts in our sources tell a completely different story.
They inherited it. They lifted it directly from antiquity. This concept, the alpha privative, was a highly productive piece of ancient Greek grammar long before medicine was a formalized scientific discipline.
Wow.
Yeah, we can trace this all the way back to the Hellenistic period.
Yeah.
So in the 3rd century BCE, scholars at the Library of Alexandria were already categorizing how this worked.
Just analyzing grammar.
Basically, the Greek word gnostos meant known. Stick the alpha privative on the front, you get agnostos, unknown.
Oh, which is the direct ancestor of our modern word agnostic.
Precisely. Or the natos meant death, athanatos meant immortal.
So the grammatical plumbing is thousands of years old. But the specific combinations we see on hospital charts, words like atrophy, those have to be newer, right?
They are, and this brings us to a really fascinating era in the 18th and 19th centuries. Medicine was professionalizing rapidly during that time.
Yeah.
You suddenly had standardized medical schools, official licensing boards, and massive reference texts being published.
Like Gray's Anatomy, which was what, 1858?
Exactly, 1858.
Which meant you needed everyone speaking the same language. Like if a patient's case notes were traveling between a Prussian specialist, a French surgeon, and a British doctor, they couldn't just use their local slang.
Right, they desperately needed a universal code. And because of that intense drive to standardize, we actually don't have to guess when some of these words were born.
Which is so cool.
It is. We aren't looking back into the misty, unrecorded past. We can literally point to a specific diary entry or a specific letter or a lab notebook.
And there's one story in our notes that just blew my mind because it gets an exact birth date to a word used thousands of times a day in operating rooms all over the world. Anesthesia.
Yeah, to understand the impact of that word, you really have to picture what surgery was like before 1846. It was, well, defined by screaming agony.
Yeah.
Surgeons were judged primarily on how fast they could amputate a limb while the patient writhed in pain.
Just horrific.
Truly. But on October 16th, 1846, inside the Ether Dome at Massachusetts General Hospital, a dentist named William T.G. Morton changed human history.
The Ether Dome. Such a cool name.
It is. He administered ether gas to a patient, and a surgeon successfully removed a tumor from the man's neck while the patient slept silently.
The ultimate delete key on human suffering.
Perfectly said. And watching the reports of this miraculous demonstration was a prominent physician and writer named Oliver Wendell Holmes Sr. On November 21st, 1846, Holmes sat down and wrote a letter to Morton. In it, he stated that this new induced state of insensibility needed a strong, universal name. So he proposed building it from the Greek an, meaning without, and asthesis, meaning sensation.
He literally just snapped the an Lego onto the sensation Lego.
That's it.
November 21st, 1846. We have the exact day the word was minted.
And Morton and his colleagues adopted it almost immediately. Anesthesia became the global standard. It really is the defining historical example of the without prefix.
So if Holmes gives us the perfect origin story for erasing something, we need to look at the origin story for fighting something, right?
Yeah.
For anti. And the most famous example in our notes just has to be the antibiotic.
Absolutely. Which takes us from a passive lack of sensation into an active microscopic war zone. The word antibiotic was coined much later, in 1942, by a soil microbiologist named Selman Waksman.
Literally against life, anti plus biotic.
Yeah, but what most people don't realize is that Waksman wasn't talking about, like, a pill you pick up at CVS. He coined the term to describe a brutal natural phenomenon happening in the dirt under our feet.
Just in the soil.
Just in the soil. Soil is incredibly resource poor, so bacteria and fungi are constantly fighting each other for survival. To win, they produce chemical weapons that inhibit or kill their neighbors. Waksman's anti was about microbe-on-microbe warfare.
And we basically just figured out how to bottle their weapons for ourselves.
That was the massive breakthrough. So in 1943, Waksman's lab at Rutgers University was screening thousands of soil samples, and working in the basement lab was his graduate student, Albert Schatz.
Okay, shots.
Schatz is the one who actually isolated streptomycin, which was monumental because it was the first antibiotic that effectively fought tuberculosis, which was a massive killer at the time.
But reading through the historical case studies we have, this wasn't exactly a happy, collaborative victory lap. It got incredibly nasty.
Oh, it is one of the most bitter disputes in medical history. Selman Waksman ended up receiving the 1952 Nobel Prize in physiology or medicine entirely alone.
Wow.
Albert Schatz, the guy who did all the grueling isolation work in the basement, was completely excluded. But Schatz didn't just take it. 2 years before the Nobel was awarded, in 1950, he did the unthinkable. He sued his mentor.
A grad student suing a world-famous scientist. I mean, on what grounds?
He had the lab notebooks. He could objectively prove the physical timeline of the isolation. Schatz demanded a share of the royalties and legal recognition as a co-discoverer.
And he won, right?
He did. They settled out of court. Schatz got his financial share and the legal recognition, though the Nobel Committee never went back and revised their award.
That is wild academic drama. But, the linguistics notes point out something even more important about this word. We call these drugs antibiotics. And the prefix implies a definitive victory. Like, you send in the antibiotic, it is against the bacteria dies, we win.
Which is the greatest semantic trap in modern medicine. The prefix anti encodes a promise that biology simply refuses to keep. We named these drugs as if they were absolute fixed weapons. But bacteria are living organisms. They evolve, they mutate.
They adapt.
Right. If a bacterium survives an antibiotic assault, it can actually package its resistance genes into tiny loops of DNA called plasmids and literally hand them over to other bacteria.
Like passing a biological flash drive.
Exactly like that.
So it's not a permanent victory, it's just a never-ending evolutionary arms race.
And the tragic part is that the pioneers of these drugs warned us about the language of overconfidence. Alexander Fleming, the man who discovered penicillin, he gave his Nobel lecture in 1945.
Okay.
And during that speech, he explicitly warned that if you underdose a patient, you aren't just failing to cure them, you are actively educating the microbes. You are teaching them how to resist. He predicted the rise of resistant strains before penicillin was even widely available to the public.
Which brings us right into the lap of anyone listening to this deep dive right now.
Yeah.
If your doctor has ever given you a Z-Pak and told you to finish every single pill, even if you feel 100% better on day 3, this is why.
Exactly.
You aren't just fighting your own sinus infection, you are trying to prevent Fleming's exact nightmare. We thought anti meant game over, but it really just means it's the bacteria's turn to adapt.
That's a perfect way to internalize it. Clinicians know that fighting an infection is a negotiation with an adapting enemy, not a guaranteed knockout punch.
This actually makes me question our previous assumption about the other prefixes. If anti isn't an absolute victory, are a and an truly absolute? Because if I see an word on my medical chart, does it actually mean a total 100% absence?
You're touching on, honestly, the main issue clinical linguistics students face. In the modern hospital, absence is rarely a total void. There's this semantic drift that happens when ancient Greek meets a living patient. Let's take the word anemia, literally. Plus imia, without blood.
So if I'm diagnosed with anemia, my veins aren't completely empty. I'm not a ghost. Why use a word that literally translates to without blood?
Because taking the root literally leads to fundamental misunderstandings of physiology. Hemoglobin in your red blood cells carries oxygen. Your body can compensate for a slight drop in those cells. But eventually, you cross a functional threshold where the body can no longer keep up, and you start feeling fatigued and weak.
Okay.
So anemia doesn't mean a total void. It means a clinically significant deficiency. The same applies to atrophy, literally without nourishment. But a patient experiencing muscle atrophy hasn't had their muscle instantly vanish into thin air. It describes a progressive wasting away over time.
Are there any exceptions where the delete key actually deletes the thing entirely?
Yes. A crucial one is apnea, O+nea. Without breathing. The most common form is obstructive sleep apnea. This happens when the muscles in the back of the throat relax too much during sleep, physically blocking the airway. For those moments, the negation really is absolute. Airflow completely stops for 10 seconds or longer. And this isn't rare. It affects roughly 1 in 4 to 1 in 5 adults, many of whom have no idea it's even happening.
So context is everything. Anemia means dangerously low, but apnea means completely stopped.
Exactly. And to make it even more complicated, sometimes A is used as a soft, almost apologetic negation. Consider the phrase atypical pneumonia.
Atypical, meaning not typical.
Right, but it doesn't mean it's without type altogether. It just means a patient's symptoms don't perfectly align with the classic bacterial cluster doctors historically expected. Or look at atypical antipsychotics. That label was created to distinguish a newer second generation of psychiatric drugs from the older first generation ones.
But wait, haven't those second generation drugs been around for decades now?
They have. In fact, they became the typical first-line choice for many conditions. But we still call them atypical because the marketing label just got frozen in time as a historical artifact.
This really highlights why our sources emphasize looking at the neighbors of these prefixes. If you're going to navigate this language, you have to know what words are living next door. For instance, what's the difference between apnea, which we just established is a total absence of breath, and dyspnea.
That's the physiological difference between absence and impairment. Dys is a prefix meaning bad, difficult, or painful. So dyspnea is labored breathing. You're out of breath, maybe panting after running up the stairs. The breath is present, but it's a struggle. Apnea is the breath stopping entirely.
And what about the prefixes for the heart? When I watch medical dramas, they're always shouting about tachycardia or bradycardia. Where does the delete key fit in there?
This is a perfect illustration of the spectrum. The heart has its own electrical pacing system. Tachy means fast. Tachycardia is a rapid heart rate, usually over 100 beats per minute. Brady means slow. Bradycardia is a resting heart rate under 60 beats per minute.
Okay, got it.
Both of those prefixes describe the speed of an action that is actively happening. But if you want to describe the total absence of that electrical activity, the true flatline, you use the privative prefix.
Asystole.
Yeah.
A plus systole. Without contraction.
Exactly. It denotes a complete cessation of electrical and mechanical activity in the heart. And the stakes of getting these neighbors confused are incredibly high. Think about hypoxia versus anoxia. Hypo means below normal. Hypoxia is a state of low oxygen reaching your tissues. The body is struggling, but the tissue is potentially salvageable.
Right.
Anoxia and plus oxia is the complete absence of oxygen supply.
So if an emergency room nurse writes the wrong prefix, they are confusing a salvageable injury with a potentially irreversible brain death scenario.
The precision of the prefix dictates the triage. And speaking of precision, we have to talk about a massive spelling trap that constantly trips up nursing and pre-med students. And honestly, it can confuse patients reading their own charts, too.
Let me guess. Anti versus ante.
That's the one. Spelled A-N-T-I versus A-N-T-E. They sound virtually identical when spoken quickly, but they come from entirely different root languages and describe completely different concepts.
Well, we know anti with an I is Greek for against. So what is ante with an E?
It's Latin for before.
Ah. So when a pregnant woman receives antenatal care with an E, it means care occurring before birth.
Correct. But students frequently misspell it on exams as antenatal with an I.
Which would literally mean a medical specialty that is actively against birth.
Right.
That's not a hospital department anyone wants to visit.
It's a funny mistake on a vocabulary quiz, but it really underscores why knowing the etymology matters.
So bringing all of this out of the ancient libraries and the nursing exams, why does this matter to you, the listener, the next time you open your medicine cabinet?
It matters because this ancient combinatorial code is sitting on every shelf of your local pharmacy. When you take an antihistamine for your pollen allergies, an antiviral for a seasonal bug, an antidepressant, or an anticoagulant to prevent blood clots, you are holding the legacy of Alexandria and the Ether Dome in your hands.
Let's look at an antipyretic. That's the technical term for a fever reducer like ibuprofen. There is no such thing as an antipyretic. You don't take a pill that just turns off the concept of a fever. You take an active agent that initiates a biochemical cascade against the fever.
And understanding the exact limits of these words is crucial for public health. Think back to the early days of the COVID-19 pandemic. The word asymptomatic was everywhere.
Asymptomatic. Without symptoms.
But a dangerous number of people conflated without symptoms with without infection. Understanding the precise linguistic boundary that the A only erased the visible signs of the illness, not the viral load multiplying in your respiratory tract, was vital.
Yeah.
If you understood the prefix, you understood why isolation guidance mattered, even if you felt perfectly healthy.
The accuracy of our language literally dictated the safety of society. That's a heavy realization. Well, as we wrap up this deep dive, I hope the next time you look at a doctor's chart or a prescription bottle, it doesn't feel like an impenetrable wall. You aren't supposed to memorize thousands of individual words. You just need to recognize the little Lego pieces and know whether they are erasing a problem or fighting it.
I'd leave you with a final thought to mull over, one that our sources hint at but can't fully answer. We've seen how atypical can become a frozen historical artifact, and how the definitive victory promised by antibiotics is unraveling due to evolutionary resistance. The language of medicine is constantly playing catch-up with the reality of biology.
So where does the language go next?
Think about the cutting edge of medicine today. mRNA vaccines, CRISPR gene editing, immunotherapies. These therapies don't simply erase an issue with an an or forcefully oppose an issue with an anti.
Right, they do something completely different.
Exactly. They rewrite genetic code. They tag malicious cells so your own body can recycle them. They cooperate and reprogram. If the therapies of tomorrow aren't about simple absence or brute force opposition, what ancient scrolls will we pull from to name them? Or will we finally have to invent entirely new prefixes to describe what the human body is becoming capable of?
We might need a completely new box of Legos. Until then,
Okay.
keep decoding.